Hello everyone, my name is Leah Ryan. I come to you with this grant proposal on behalf of Regis College as a graduate student in the Masters of Science in Nursing program. Aside from pursuing advancement in my education, I also practice as an emergency department nurse. This is a topic I am very passionate about, so I thank you in advance for your consideration. The title of this proposal is Triage Strategies to Decrease Door to Disposition Time in the Emergency Department. The purpose of the emergency department and ED nursing is to provide expedited, efficient, high-quality care to those facing life-threatening and critical illness. There are numerous systems in place that begin in triage that aim to expedite patient flow throughout the department, but these systems do have flaws. There are two main problems with the current systems. The first is once the department is full, there is no place to put the acute patients as they continue to present to the department. The second is nursing is required to care for all acuities of patients simultaneously. The ability of nursing to provide the exceptional care that each patient deserves is obstructed by the extreme volume of the patients. In addition to the volume, the patient's time in the emergency department is typically significantly longer than necessary. The volume in the ED is likely a result of the United States' struggle to provide universal health care. Many of the uninsured use the emergency department for routine visits or non-urgent or life-threatening complaints. This results in an overcrowding of the emergency department, increased wait times, longer length of stay, and compromised patient safety and frustration among staff. Emergency department utilization has been steadily increasing since the 90s. Since Medicaid was implemented, the rate of emergency department visits increased from 44% to 62%. This 13% increase in volume in the emergency department indicates the need for process improvements and expedited care and dispositions for patients that do not require the acuity of emergency department services. The purpose of this project is to investigate potential practice changes that could be implemented in the ED and evaluate the effect of these changes have on patient flow throughout the department. The aim is to expedite patients' door-to-doctor time and decrease total length of stay in the emergency department. The formal research question to be answered here is, what practice changes can be implemented to improve patient flow in the emergency department? The facility that this project will take place at currently utilizes the Manchester Triage System. The Manchester Triage System scores patients on a level 1 through 5. 1 is the most acute and requires the most resources, while a 5 typically requires little to no resources. Patients with a triage level 3 through 5 could have a drastically reduced time in the department if their treatment began as soon as they were registered. For example, staffing a technician in triage dedicated to electrocardiograms and phlebotomy, designating an attending physician to the triage patients, and staffing a second triage nurse that could fulfill the physician orders could allow for discharge or admission from triage. A process such as this would allow the nurses and physicians in the department to prioritize their critical patients with less distraction of non-acute tasks. There's much literature that reviews the challenges the emergency department faces due to increased volume, lack of resources, and overcrowding. Yet there is limited data to demonstrate a solution. Current literature demonstrates a magnitude of research dedicated to improving the flow of the emergency department. There is limited cohesive data to determine which solution works most efficiently. Many strategies implemented reflect some improvement. However, there is limited research to assess the hospital's adherence to these methods and if the improvement continues after the study. Based on available data, fast-track systems appear to be the most cost-effective and most efficient in minimizing patient wait time and decreasing length of stay. Nurse ordering and triage is also identified as a low-risk, effective means to expedite patient workup and decrease the overall length of stay. There's minimal data to determine if a combination of these methods would further minimize length of stay and wait times. In review of current data, it is clear that there is opportunity to prevent some patients from utilizing the emergency department at all if this opportunity is identified in triage. The goal is to minimize the patient's length of stay and decrease wait times in the ED while maximizing resources and improving costs. Implementing methods to address this common goal as soon as the patient presents to the department and is triaged could drastically reduce these metrics. Further research is needed to address this knowledge gap. The research sample will be collected by voluntary participants. The participants will be provided an informed consent document to review. The outcomes will be used to evaluate the effectiveness of the proposed change. Some of the measurements of outcomes will be evaluation of patients' time in department. A second will be nurse and doctor satisfaction with the interventions applied. A survey will be developed to address the new interventions and allow opportunity for staff to express their likes and concerns. A third measurement will be patient and family satisfaction with the interventions. As the patient is likely unfamiliar with the previous triage methods, a survey will be developed addressing the patient's satisfaction with their visit. Questions the patient will answer here are in regards to staff attentiveness, satisfaction with timeliness, and overall visit satisfaction. The last evaluation, and potentially the most important, is the evaluation of patient bounce back rate. For the purpose of this study, the bounce back rate will be considered representation to the emergency department within 72 hours. This metric will determine if the patient's previous visit was successful or not. Analysis of these outcomes will be performed by the nurse researchers at the medical center, as well as by the research team. Pearson's chi-squared test will be used to assess the expected versus actual outcomes and clarify if the results obtained are of statistical significance. Staff turnover and nursing burnout are critical issues among nurses in the U.S. Studies have demonstrated that improving the work environment may lead to higher job satisfaction and decrease the nurse's intention to leave. Dedicating staff members to manage triage patients will lessen the burden on the triage nurse as well as nurses staffed in the emergency department. Lessening the workload and adapting to new practice changes has been shown to increase the nurse's sense of fulfillment and ability of the nurse to provide exceptional care to the patient. In turn, this leads to increased patient satisfaction. This proposed change is similar to Fast Track in that the goal is to expedite workups and dispositions. It differs in the sense that the patient will not be moved into the emergency department and occupy a room while the workup is being started. This is beneficial to the overall flow of the department because the volume of patients being seen in rooms would decrease, allowing the staff to focus more on critical time-sensitive patients. It would also decrease the door-to-doctor metric. Decreasing the door-to-doctor metric has been proven to reduce patient mortality and reduce overall cost and length of stay in the hospital. Similar research studies that have evaluated the usefulness of Fast Track have shown significant reduction in hospital costs as patient stay is shortened and adverse events are minimized. I hope you can see by now that performing more research about this topic is entirely necessary. There are many pros to this proposed research study, with essentially no risk to the patient and staff. The study serves as potential to drastically improve the patient and staff experience in a busy emergency department. Thank you all for your time and consideration. I'm happy to take up any questions as they arise, and I can be reached by email as provided on this slide. Again, thank you all for your time.